For a kind of a general overview of Social Security, Medicare, Medicaid. I worked at all of these places. I ran the third busiest Social Security office in the country. Before that, I worked for the Department of Social Services. And then many moons ago, when I actually had more hair, I was a sergeant in the Marine Corps. So I've spent quite a few decades inside the bureaucratic beast. So I just wanted to, this is a live broadcast. I'm just going to do an overview of all the programs out there so you and your family and friends are aware of what's available to you and kind of some of the general eligibility guidelines. And then, as usual in these live broadcasts, I do a live Q&A. So at the end, make sure you type your questions in the chat there, and I will get to as many as I possibly can. We're finding lots and lots of money out there. A lot of people are leaving money on the table. And so we're finding money for people every single day. So let's make sure that's you as well. Okay, so just an overview. We're also going to talk about ACA as well for those people that are retiring early at 62 or waiting for their Medicare to start. That is an option. All right, so in terms of Social Security, we all know retirement. We all know Social Security cards. And unfortunately, a lot of people think that's it. And they are missing a lot of money out there, a lot of benefits they could be eligible for. So retirement, the earliest you can receive retirement benefits at 62. Your full retirement age, that changed, effective in the 1980s. So it's going all the way up to 67. There's some rumblings of, some politicians are talking about increasing it to 69 or 70. Hopefully that doesn't happen. But in order to get delayed retirement credits, you can actually wait till 70 years old. Delayed retirement credits is, say, for instance, if you waited from 67 to 70, you get an extra 24% above and beyond your full benefit amount, your full retirement age amount. 8% every year. So there's retirement. The earliest you can do is 62. Disability, you can do anytime you become disabled and unable to work. Social Security defines disability as the inability to work because of your disability. The disability has to last 12 months or longer. There is no short-term disability at Social Security or end in death. So if you're diagnosed with a terminal thing, then obviously the 12-month might not apply. So that's why they've added that in there. So adults can receive disability. You can get disabled adults. Children that became disabled before the age of 22 can get disability benefits. Disabled widows benefits. So if you didn't pay into Social Security yourself or not enough, then if you have recently widowed or widower, surviving spouse, disabled from 50 to 60 years old. Other than that, just a general surviving spouse, widow, widower, it's all the same for Social Security. You can start your surviving spouse benefits at 60 years old. And then they have obviously spouse benefits, including divorced spouse benefits. So if you're currently married to a person, you have to file for benefits on your own record. That person has to file for benefits on their record, and then you can file a spouse claim, and that starts at 62. You can also file a divorced spouse claim. If you were married to the person for 10 years or longer, then you can file for divorce spouse if you're no longer married right now, and their benefit amount is twice your benefit amount. That is your full benefit amount. Your PIA is what they call it, primary insurance amount, your benefit at your full retirement age. So if your spouse or divorced spouse's benefit is over twice, then you're eligible for those spouse benefits. Again, talked about the children, disabled adult children, children that are up to age 18. If their parent is receiving retirement or disability benefits, children can receive benefits or auxiliary benefits. Their other parent can receive benefits. It's called the auxiliary child in care benefits, that they're taking care of a child that's under 16 or became disabled. So again, I'm just kind of doing a kind of water skiing through all the programs here. I've got close to 500 videos out there on all of the details of these programs, but there's not a lot of videos out there that kind of go over the big picture. So I figured I'd go ahead and make one and add it to our resource library. And then there's SSI, Supplemental Security Income. I just did a video on this, and A lot of people didn't watch the video. The title of it is SSI is welfare, and everybody, I said this is a common misunderstanding about SSI, and people didn't watch the video and just said SSI is not welfare. We paid into it. No, that's SSA. SSI is welfare. It's the nation's largest welfare program. It started 50 years ago in the early 1970s. SSA started in 1935, but SSI, supplemental security income, you can get based on disability or aged, 65 and older. And though because it's a welfare-based program, a means-tested program, you have to have limited income and limited resources. So this is not SSA, it is SSI. So a lot of people comment and say, "Oh, you don't know what you're talking about. We paid into it." It's like, please watch the video. So anyway, Medicare. All right. So to sign up for Medicare, you actually go to the Social Security Administration as well to sign up for Part A, which covers your hospitals, and then Part B covers your doctors. So if you go into the hospital and have a surgery, the hospital is covered by Part A, the surgery is covered by Part B. And original Medicare, there's no networks. Anybody that takes Medicare, doctors, clinics, hospitals in the country, take Medicare. You don't have any pre-authorizations. If Medicare covers it, then you're good. But original Medicare has a lot of gaps. The biggest one being Part B. It covers 80%. So that surgery you had in the hospital, they charge you $100,000 for the surgery itself. You have to pay $20,000. That's why people get either what's called a Part C, which I don't really like that name, which is the Medicare Advantage plans, or a Medicare supplement plan, also called a Medigap plan. So to cover the gaps, the 6 gaps of original Medicare Part A and Part B, those are the 2 options: a Medicare supplement or a Medicare Advantage plan. And you get those through agents or brokers. I always recommend brokers, agents. You usually just, represent one company. So kind of like the old Henry Ford, right? You can have any color car you want as long as it's black. So brokers represent you, and they go into the market in your particular area and find the best plan that's available for you. And if you need help with that, I have, because so many people are doing the wrong thing out there, I have decided to put together my own network of brokers that can help you throughout the country. So give me a call and we can find someone to help you out. Same thing with Part D. Part D, you do not sign up at Social Security. Part C, the Medicare Advantage, Medicare supplements. Part D, prescription drugs, Social Security does not sign you up. I ran the 3rd busiest Social Security office in the country. We had people coming in all the time, says, "Yeah, I want to go ahead and sign up Part D." Well, you go find yourself a Part D company that is in your area based on your prescriptions and tiers. And all of this I just did a video last couple of days that is this perhaps the beginning of the end of Medicare Advantage plans as we know it, because there's massive changes. Medicare Advantage has been around for 20 years or so, but probably this is the biggest changes coming next year. A lot of kind of a perfect storm of all kinds of different acts and regulations. And so there's going to be a big changes. So it's super important that you check your Medicare Advantage plan in the fall when the new plans come out, because if you don't, you're going to be very surprised in 2025. There's going to be a lot of things changing. All right. So Medicare, again, Part A, Part B, you sign up at Social Security. Everything else, you find someone to help you out. Then there's state social services. Medicaid, they call them different, different offices throughout the country. Idaho Department of Social Services or Texas Department of Welfare or whatever the case may be. They go by different names. But those are the people that sign you up for Medicaid. It's not Medicare. Medicare is the federal program that is administered by, you can sign up in Social Security. Medicaid is a welfare-based, means-tested, low income, low resource program that is administered by the states. Yes, with federal funding. And there's millions of people that have Medicare and Medicaid. You can have both, just like you can have SSI and SSDI. You can have both of those depending on how much your SSDI is, Social Security Disability Insurance. So if it's not very much, Social Security will also give you SSI, supplemental security income, if again, income and resources contingent. So you can have Medicaid and Medicare. And in those particular cases, I recommend a Medicare Advantage. Definitely check out a Medicare Advantage. You should be able to get some extra benefits in your particular area. Those are the ones that usually have the most benefits in particular areas. And again, it depends on your particular area. So Medicaid, and if you're eligible for Medicaid, there's called the Medicare Savings Program. So if you're having difficulty paying for your Part B premium, this year it's the $174.70. Then you go down to Medicaid and say, hey, I'm having difficulty paying my Part B premium. And they'll check you out for Medicaid and see if you're eligible. And if you're eligible, then they will start paying your Part B premium. So you'll have Medicare, Medicaid, and you won't have to pay for your Part B premium. So a lot of people have taken advantage of that. But research has shown there's millions of more people that can use that extra benefit, but are just not taking advantage of it because they don't know it. So please make sure you share that information. So Department of Social Services, also the places where you get signed up for food stamps, EBT, and all the rest of it. So affordable electricity, and they can help you with all kinds of different. I also did a 4-part series on living on Social Security alone. The introduction, I agree, is a little bit long. Just fast forward to that. So the title is Living on Social Security Alone, and it's 47 programs that might make your life easier, or someone you know and love that want to take care of. So make sure you watch those. And yes, the $30 internet connectivity thing has gone away. I made the video before that. So. And then for those people that need health insurance before Medicare starts, or in your 30s, 40s, or 50, then there's the Affordable Care Act, also called Marketplace Insurance, also called Obamacare. And there's been a lot of fraud over the last year or so. A lot of agents have gone out there and switched people without them knowing their plans. So there's a lot of things to watch out for there. But the government, the Center for Medicare and Medicaid Services, has finally come down, and they're getting rid of those people, those bad actors. But if you're, for instance, if you're 60 years old and you go file for survivor benefits or retirement benefits, and you're waiting for Medicare to start, then the Affordable Care Act is the way for you to go. And I have recently put together a team, which I think is the best team in the country, on helping people with the Affordable Care Act. So if you need help with that or Medicare plans, make sure you email me or call, leave a message, and I will find someone that can help you out in your particular state. All right, so we didn't do too bad, 12 minutes. So let's go ahead and answer some of your questions. So I'll have about the next 45 minutes here to go through as many questions as we have time. Okay. Emil, if collecting a spousal benefit and spouse dies, do you have the option of switching to former divorced spousal benefit instead? Yes, absolutely, with more money. But if the other spouse is still out there alive and kicking, there's usually more money in surviving spouse. Because with a surviving spouse benefit, you can get up to 100% of their benefit amount. If the person is still alive and kicking, you can only get up to 50%. But if you're no longer married now, you can get benefits from a previous record. You just get which one is the most. If you file for Social Security at 62, your income is only limited till 67. Then you can make anything. That is correct. It's called the annual earnings limit. This year, it's $22,320. So anything over that, they withhold $1 for every $2 you go over. The year you turn your full retirement age, it's 3 times that amount. And then once you hit your full retirement age that month, then you can make $1 billion a month, and there's nothing withheld. Absolutely. Is there such a thing as emergency Medicaid if you get diagnosed with serious illness, in case you don't have Medicare or are too young for it? Emergency, Medicaid can start anytime. With Medicare, if you're on disability, your Medicare won't start until you're on disability for 24 months, which I think is a terrible policy, but there it is. But in the meantime, yes, you can get the Affordable Care Act or Medicaid. Absolutely. when is open enrollment for Obamacare? You can have pre-existing. Yeah, Obamacare, the Affordable Care Act, Medicare, Medicare Advantage, all of those, they can't discriminate you based on any pre-existing conditions. For some reason, the only place that can are Medicare supplements. That's why, when you turn 65, it's a very, very good idea to see whether Medicare supplement, whether it's in your budget. But I always recommend those because there's, no no networks, no pre-authorizations. And when you're doing it when you're 65 or new to Medicare Part B, then there is no medical underwriting. They don't ask you any type of medical questions. It's guaranteed issue. So yeah, if you're in Obamacare, and usually generally for Obamacare for enrollment is in the fall. But if you have some type of extenuating circumstance, um, you just recently lost your coverage, or you moved or something like that, or you gained a family member, um, or lost someone in your household that had it on your policy, then you can change. So yeah, email me if you're interested, and I can find someone to help you out in your particular area. Hey doc, if I'm still working at 65, 67 and eligible for insurance through job and cheaper than Medicare, can I take that insurance without penalty? Yes, absolutely. If yes, what is the time window to apply when job insurance ends? Yes, if you have health insurance from work and your employer has 20 or more employees, you or your spouse, then you do not have to sign up for your Medicare Part A, Part B. Some people go ahead and sign up for Part A because there's zero premium. But yeah, definitely avoid Part B if you have health insurance from work and you're happy with it. And yeah, once you stop working and stop receiving health insurance from work, you legally have 8 months to sign up for Part B, and there's no penalty. But I always recommend, a couple of months before your health insurance is going to stop, sign up for Part B. And that way your health insurance stops one day at the end of the month, and your Medicare and everything starts the next day, rather than having 8 months without health insurance. Because you know what happens when you don't have health insurance for 8 months. That's when you actually, get sick or fall or whatever. Taking to update video, everyone, to help show the up. Yes, please, please. This is how the information gets out there. Is y'all get it out there. I just record the videos and y'all get it out to people that need it. Sandy, hi doc, if I'm still okay, I think I already answered that one. Let's see. Friends say that have a plan that pays them back the money each month and gives them $100 card each month to use for anything like paying bills. Yeah, so it sounds like the Medicare Advantage plan, and there's a few different ones, maybe what you're talking about. There's one that pays your Part B premium. The Center for Medicare and Medicaid Services, the government Medicare, allows companies to do that. So they have plans, it depends on your particular area, that pay all or part of your Part B premium. So it's zero premium per month for the plan itself, and they might pay $50 or $100 of your Part B premium. They pay it directly to Social Security. So, but those, I always caution, these insurance companies don't get to be billion-dollar insurance companies because they're stupid. If they're going to if they're going to pay your Part B premium $100 or 100, all of it $174 every single month, then they're going to take it out of somewhere else. So if you're young and healthy, young 65 and healthy, then yeah, might be a good idea. But if something happens, there's the details, that might charge more for a hospital or an MRI or a emergency room than another plan that doesn't pay that $100. But if you're healthy and you really, really need the money for a year, again, all these plans are good for 1 year. So you can sign up for, one that pays your Part B for 1 year and hope you didn't get sick or fall. And then the next year you're like, oh, okay, well, all right, I'll go ahead and switch to one that covers my health a little bit better. And, I'll give up to $50 or $100 or whatever the case may be. And then there's also other plans that, particularly the dual eligible. Those are for people with Medicare and Medicaid. Those are the ones with, a lot of different benefits, including those infamous, grocery cards, the flex cards that you hear about, that the government, again, is coming down on these insurance companies, and, that are advertising these things incorrectly. What they do is they take the best one in the country and they advertise it everywhere. And then when you call them up, they say, "Oh yeah, well you don't live in this particular zip code, so you can't get it." And then, but they've got you on the phone and they try to do that hard sell. But yeah, they do exist. The grocery cards exist. Those flex cards exist with the extra dental, vision, hearing, and all those type of thing. But it really depends on your particular area. So make sure you get with someone you know and trust to help you navigate the Medicare bureaucracy and all the policies. So again, email me and we can find someone to help you out. Let's see. Can we get this kind of plan in any state? They are in Florida. We are in Alabama. Yeah, Florida actually has the best Medicare Advantage plans as compared to others. Um, yeah, I hate to use best because there's no best. It really depends on your particular, people buy the the Medicare Advantage plans because it's zero premium. It's got my doctors, and they just forget about it. And they say, "Oh, my neighbor has that one, and they really like it, and so I'll get that one too." But every particular situation is different. That your next door neighbor might not have the same doctors or prescriptions or needs that you do. So there is no ultimate best for everybody across the country. It's your particular area, your particular needs, and because all of these plans change every single year. A lot of people don't realize that. They say, I have had the same Medicare Advantage company, the same Medicare Advantage plan for 2 or 3 years. I'm like, no, no, no. You've had it for 6 months because it all changes. They all, like Cinderella, December 31st, midnight, they all disappear and then a new one comes in. You might not notice the differences, and that's usually by design, but you will once you get sick or fall or something like that. All right. Let's see. RA is January, or we probably mean your FRA, your full retirement age, is January 2026 on disability and would like to have just Medicare, Medicaid since the $59,000 limit. Can I do that, or when can I do it? Suspend. All right. So yeah, if you're on disability and the Medicare savings program there, then yeah, once you hit your full retirement age, you're automatically switched to retirement benefits at your full retirement age. So at that time, you can make all the money in the world. And yeah, if you want to, it sounds like you want to switch the beginning of the year or something. Well, no, you're January 26th. So yeah, so there is no benefit for you to get off of disability. It'll be automatic. You'll get off disability starting January 2026 if that's your full retirement age month. Can you provide a video comparing state pension versus Social Security, the windfall formula? Yeah, I've done a few of those. Let's see. If I did probably DIB, you mean disability, at 62 years old and win disability, what would be the payment after full retirement age? Same. Yeah, once they determine what your benefit amount is, it never changes, except for obviously COLA and stuff like that. But how old do you have to be to file on the ex-spouse of Social Security? 62, was married over, yep, 62 years old. Unless your ex-spouse is now deceased, you can file for surviving benefits starting at 60, but regular spouses at 62. Uh, what do you know about cash assistance payments for immigrants? This is something in California. Is this a state dependent? Yeah, each state is doing a little bit different. Yeah, people always think that Social Security gives out money to undocumented illegal aliens, whatever the case may be. But no, Social Security, when they give you your money, that's one of the hoops you have to jump through is prove your citizenship or your legal status in the United States. So you have been a blessing. Yeah, thank you. Appreciate it. Mario, I filed my SSA this month in June to start receiving my payments in July. Do I have to stop working in July? I won't get my check until probably August. Is that correct? Yes, that is correct. So you start your benefits in July, you'll get your first check. The July check comes in August. And yeah, because it sounds like you're doing early retirement. So the first month when you start collecting benefits, so that's July, you're actually collecting benefits in July. You don't get the check until August, but your benefits start in July. Starting July, you have to stay under the monthly earnings limit. If you've already gone over the 22,320 for the year, or you will, that's no problem. Starting July, you have to stay under $1,860 going forward for the rest of the year. And the next year, you have to stay under the annual earnings limit. Does Social Security raise red flags if you work under SGA while on disability? No, as long as you're under there, I wouldn't work right up to SGA. Make $1,550 every month for months, and because that's it's like, oh, this person knows the limit and they're working right to the limit. They can work a little bit more, but yeah, I always recommend about $100 or so under the SGA, and you should be good. Is it better to take Social Security at your full retirement age and invest it, or is it better to wait? Yeah, there's way too many variables. Depends on your health and your longevity in your family, and whether you need the money. If you need the money, get it. Uh, I noticed on my doctors after summary visit, there's now listing my illnesses. Like one of them is rheumatoid arthritis. What is? Yeah, I have no idea. I'm a doctor, but not that kind of a doctor. If you're divorced and the ex-spouse goes after your benefits, does that decrease your benefits when you apply? Absolutely not. Yeah. So a lot of people, again, another place that people are losing probably tens of millions, hundreds of millions of dollars. They're not filing for divorced spouse benefits because they think it will affect their divorced spouse and their new family and kids and stuff like that. So they don't want to cause any trouble, so they don't file. But no, doesn't affect those benefits at all. 63 on disability and can't get a supplement. Yeah, yeah, unfortunately, in a lot of states, that's the case. With changes coming out, what can I do? Also, SSA said I was over. Okay, let's answer that first question first. Yeah, a lot of states, so the Medigap, the Medicare supplements, those are state, all insurance is, state regulated. Um, and that's one of the sales tactics, people that sell burial insurance, because when somebody passes away, Social Security gives you a check for $255. I've given out hundreds of thousands of those checks, and nobody's ever been happy. So I recommend, if you don't have some money to cover your burial and medical expenses and debt or whatever the case may be, I recommend burial insurance. Um, but yeah, that's one of the kind of the things that they use is they say, yeah, this is a state, burial insurance, state regulated burial. Well, all insurance is state regulated. Auto insurance, home insurance, Medicare supplements, all of it is state regulated. But yeah, Medicare supplement, because it's state regulated, each state has determined whether they mandate Medicare supplements to offer their plans to people under 65, and in some states they don't. In some states they do, but then they don't regulate what plans or how much you can charge. So the Medicare supplements, companies can charge you 4 times what anybody else would pay. So a lot of people, unfortunately, under 65 can't get or afford a Medicare supplement plan. But once you hit 65, you're in a brand new window. So you can get a Medicare supplement plan, and any type of disability or pre-existing conditions means nothing, and they can't charge you extra. Everything starts fresh. So yes, I would definitely. A lot of people miss that because if you're on disability, you probably use a lot of health care, and that's one thing. If you can afford it, um, average Medicare supplement, an N plan, about $80 average throughout the country. New York, it's 3 times as much. Medicare Plan G is about $125. But there's no networks, no pre-authorizations. And so people with disability, would rather have a Medicare supplement if it's in their budget. All right, second question. Also said I was overpaid due to a settlement. Should I apply for an appeal? Um, yeah, I'm not exactly sure what the settlement was. Maybe it's probably a workers' comp type thing, a public disability benefit. Yeah, you can appeal anything that Social Security makes a final decision on. So once you get that decision that they're going to offset because of that public disability, then workers' comp type thing, then yeah, then you can definitely appeal. Stop work next year at 62. Planning on waiting until 70 to start collect my Social Security benefits. Already meet the requirements 40 quarters. That would be 8 out of 10 years not paying into FICA. Yeah, so the benefit amount you see on the internet on the mysocialsecurity.gov is going to be incorrect because that forecasts you continuing to work about the same amount going forward. So if you stopped, then yeah, your benefit the estimate online is going to be wrong. Do you have to have Medicare if you're self-insured with expat medical insurance? You don't, as we used to say in the Marine Corps, you don't have to do anything in life, but if you don't do X, Y, and Z, there will be repercussions. If you don't want Medicare, you don't have to sign up for it. Don't have to pay for it. But the thing is, if you decide later that you want it and you're 70, 75 years old, then when you sign up for it, you can only sign up for it in January, February, March, and you will be penalized for the rest of your life. 10% for every 12 months. So if you wait till 70, you're going to have to pay 50% extra per month for the rest of your life. So there's that. What age do you have to take Medicare when you're not working? Yeah, 65. If you don't, and this also includes work from your spouse. So if you're receiving health insurance from your spouse's current work, then you don't have to take Medicare at 65. If collecting a spousal benefit on current spouse, can you switch to survivor benefits on former? No, unless you were remarried after 60. Yeah, but you'd already have to be starting the benefits. Let me get this other thing. Widow 65, working full time. Any reason I should not file for survivor benefits? Yeah, it all depends on your particular budget, whether you need the money. But I would definitely call Social Security and check the benefit amount, because there's a thing called the rib limb, a widow's cap. And if your ex-spouse took their benefits very early, 62, 63, then your benefit amount just might cap out at 62 and a half. So it won't increase anymore. It'll be 82.5% of their benefit amount, and it won't increase at all. So I would definitely call and say, hey, how much would my survivor benefits be this month? And then they'll tell you and say, okay, how much will it be next month or next year? And that way it'll give you an idea whether your benefits are actually going to go up. I'm 58. My husband is 68. He's already getting his SSI, and that's the welfare-based program. So you probably mean SSA. What's the earliest I can apply? 62. You can apply for, if you really mean SSI, the welfare-based program, if you're disabled, you can apply it at any time. I will be 60 in January. My husband passed a year ago. He didn't have enough credits paid in. Can I draw widow's benefits? Yeah, if he didn't pay into it enough, then there's no survivor benefits there, unfortunately. So you would have to wait till you're 62 to file for benefits on your own record. If I take my husband's death benefit at 60, do I go on Medicare then? No, I wish that was the case. Yeah, you still have to wait till 65. I am retired and the county pays my insurance 100%. So at least you got that. Yeah, I've got a specific company. I don't talk about specific insurance companies. 63 on SSDI. I need little help. I've been on since 2000 on Advantage plan in Arizona. Yep. So if you want to check out, see if your Advantage plan is the best or whether there's something better out there for you, email me your name, phone number, your state, because they're all state specific. And then tell me that you're looking for, Medicare Advantage or whatever the case you're looking for. Thank you, Ed, for all you're doing to educate the public on Social Security and Medicare. You're welcome. 50-year-old female, 15 years on SSDI, married 59-year-old husband's health insurance, pros, cons, taking Medicare now and getting off private health insurance versus staying. Yeah, you have to compare apples and apples. Compare your current health insurance from Medicare. Medicare Part A is free or zero premium. Part B, $174.70, and then you need something to supplement it, either a Medicare Advantage or a Medicare supplement. So yes, it really depends. You really have to sit down with both versions and see what is best for you, how much your insurance company charges. So a lot of people I've got health insurance from work, but it's like a $5,000 deductible. And so those people usually switch to a Medicare plan. I'll be turning 65 next year. I've been married for 30 years. I have previous marriages that have not worked in 30 years to get anything on Social Security. Can I piggyback off my ex or my husband? Yeah, off your husband. You're currently married, so you can't get any X's because you're currently married. Um, so, but again, you have to file for benefits on your own record, however much it is, or if it's zero, and then you can get 50%, up to 50% of your spouse's, but your spouse has to have filed, has to be getting benefits. I'm retired military. Do they add extra to your Social Security for years of military service? Yeah, a little bit. So yeah, when you go in there and file for retirement benefits, you tell them that you're in the military, and they just add earnings for those particular years, $300 a quarter. So it doesn't turn out to very much, but hey, every buck's a buck, right? I just want to know what I know if I apply for myself. I know I won't get it, but I piggyback off my ex? Yeah, okay, I already answered that one. Do you have brokers in Georgia? Absolutely. And how do I file and what do I say? Okay. Let me see. All right. My job has 20 employees. If someone quits or leaves, yeah. So you need to basically what it is it's the insurance company. So you need to contact the insurance company with your work. And if your employer has under 20 employees, and again, I understand sometimes it goes up and down, so you have to contact your insurance company because the issue is that if your employer has under 20 employees, then Medicare pays first. So you have to contact the insurance company and say, hey, you know, our company goes up and down. Is it considered 20 employees? Are you going to make me? Because if you don't get Medicare and your company only has 15 employees, then what happens is the insurance company is going to send you for the bill for what Medicare should have paid. So it's between your insurance, it's an issue with your insurance company. So call your insurance company and say, hey, how do you all calculate the 20 employees? And, am I good not to sign up for Medicare? And they will tell you. Hey, doc, I'm thinking about retiring about a year early at 65. I have 3 kids, 14, 13, and 15, and was told by Social Security office I would receive benefits for them and also like half of them. Yes. So, yeah, a lot of people miss money there too because, they say, well, I don't want to file for retirement benefits, early because I'm going to be reduced. But if you got kids, then yeah, that might be a very good idea because they will get benefits until they turn 18, or if they're still in high school, or 19 and 2 months. So yeah, that's that. So that could be a lot of extra money. So that might make up for retiring a month or year early or whatever the case may be. So they will receive up to 50% of your primary insurance amount, PIA. And there's also a family max involved, so they can only pay a certain amount depending on your benefit amount. So make sure you check that out, and you get all the numbers so you can make an informed decision. When they penalize a person for going without insurance before FRA, how much a month is a penalty? Same exact. So if you're on disability starting 55 and you're supposed to start your Medicare at 57, but you didn't, then exactly the same 10% for every 12 months you should have signed up. Looking for your windfall video. Can you share a search help? Yeah, just type in windfall elimination provision. Take the WEP challenge. There's a few of them. They can't on personal injuries. Okay, let's see. I have a federal government pensions. I am CSRS offset. I work 10 years in private industry. How does that work? So yeah, so you will be offset based on your non-covered pension. So whatever your non-covered pension, that will correct the benefit amount. So basically what it is, if you look online, it'll say, okay, when you retire, you're going to receive this amount. But right under it, it says, okay, this is 100% incorrect if you're going to receive a non-covered pension. So what it is they're giving you an extra welfare benefit. That's what that is for, up to 90% of your averaged indexed monthly earnings replacement rate. Everybody else in the country, the other 95% of people get about 43, 44%, but your benefit amount shows 90% because there's a welfare benefit based in there. So they're eliminating that windfall. a provision to eliminate that windfall. That's why it's called windfall elimination provision. So it just brings you down to what everybody else with your income gets. Why am I under WE? Well, if I only took one-time withdrawal from TRS, there's only a contribute. Yeah. So yeah, if you, some people try to kind of do that, they say, well, I won't take a monthly thing. I'll just take it out. But if you take it out, if you just take your money out, then there's no offset. But if you take out contributions from them, from that agency, then there is an offset. Again, the offset is just you don't get the extra welfare benefit. That's what the offset is. You don't get the extra welfare benefit that's intended for people that work low income, low resources, or low income throughout their lives. So you just don't get that extra welfare benefit. Can you get Social Security disability after getting Social Security for a few years? Says from Blymet. Yeah, yeah. If you're under your full retirement age, you can definitely apply for disability benefits. I definitely will appreciate you so much out there. None like you. Yeah, thank you. Appreciate it. I'm sorry, but I did not grasp the answer to the question regarding the impact on your benefit if you have a few years of retirement without contributions. You can choose or take the benefit. Um, yeah, so that's a windfall elimination provision. Not not WEP, if I mean to say. Yeah, so it's just, yeah, it's the extra welfare benefit that rather than give you 90% replacement factor or replacement rate, like people that are in welfare, they will just give you what everybody else gets. So you don't get, let's see, full Social Security was available mid 2022, applied and will start August 2024. Married over 29 years, spouse on SSDI. Did Social Security look at his benefits to decide mine? Married over 29, spouse on did yeah, I mean, if you're 62 years old, and I would definitely check it out. If his benefit amount is twice your benefit amount, the full benefit amount, then you're entitled to spouse benefits if you're currently not married and all that stuff. Can I change my date once I submitted my SSA form? Depends on what type of form we're talking about. Are we talking about early retirement? Yeah, if it hasn't been adjudicated yet, then definitely call them up and say, hey, I changed my mind. Instead of, July, I want to start my benefits in October. And if they haven't adjudicated the claim, then you can do that. But if they have, you might have to go through the whole withdrawal process and everything. Is religion determined in decision by Social Security? No. Let's see. What about life insurance? Do you suggest getting some? Yeah, it really depends on your particular benefit, your particular life, and whether you have savings. But think about that. That $255 lump sum death benefit. Yeah, it's been the same for decades and decades. But if you don't have, will at least take care of your burial and stuff like that, then I would definitely think about getting. Again, it's not for you because you're not going to be here, but for those around you. Social Security. Okay. I'm 65 and working with health insurance from my employer. I didn't file for Part A. Am I okay? Yep. Yep. You're good. Some people do, some people don't. Um, One of the reasons some people do is if, for instance, it depends on your health insurance. If your health insurance is really good, but if you have like a $5,000, hospital deductible on your insurance, it might be a good idea to get Part A if you're not paying into what's called a health savings account. Um, but a hospital under Part A is $1,632, so that might save you money in case you have to go to the hospital. And again, it's zero premium per month for Part A. So, all right. On survivor benefits and turn 65 in January, any advice? Yeah, anytime you're on survivor benefits, if you haven't touched your own benefits, I would definitely check yours and see if your benefit amount has increased higher than your survivor benefits. And it might next year or the year after, or when you hit 70, then switch from survivor benefits to benefits on your own. Let's see. First widow check set for 7/24. If I want to move it back until 11/24, how much notice do they need? Yeah, you need to contact them immediately before they adjudicate your claim and send you your checks. I'm 65 and a widow. Is there a limit I can earn and still draw survivor benefits? Yeah, same as everybody else. $22,320. Anything over that, they hold back $1 for every $2 you go over. With the CDR, do they give people an additional time for when they receive due to mailing? Yes, yeah, they take into consideration mailing, but they just announced that they're going to pause CDRs, medical CDRs, for the rest of the year. So no more new medical CDRs until October. So that's the first time that's happened in decades. Let's see what else here. 100% disabled veteran. Can I get SSI or SSDI? I'm 54. Yeah, Simplify. Ura, Simplify. Yeah, your veteran's disability does not affect Social Security disability at all. You can get both of them, no problem whatsoever. Can my husband claim my Social Security while I'm alive? We are not divorced. Yeah, if your benefit amount is twice his benefit amount, yes, he will receive the difference. Could I apply for disability benefits because of sugar, high blood pressure, and blood thinners? If it prevents you from working, I would definitely try. I am 65 and still working and using my employer's healthcare insurance. Will I be penalized? No. If you have health insurance from work and your employer has 20 or more employees, you do not have to sign up for Part B. Why are the colas so off? They're talking about, yeah, the 3.5%. Yeah, it's just basically any talk about colas right now is pure clickbait. Whatever the numbers now are, and the basket of goods of inflation, it means nothing. They take the third quarter of last year and the third quarter of this year, which ends in September. So all speculation of cola means nothing until October. So it's all pretty much just clickbait. Is it a good idea to retire at 62 years than later to get my Social Security? Yeah, too many variables there. Your health and whether you need the money and all the rest of it. Catlink. If I can get divorced spouse benefits, is there an advantage waiting until I get my full personal benefits? I'm 65. Yeah, to get divorced spouse benefits or spouse benefits, not surviving spouse benefits. Surviving spouse benefits, you don't have to start benefits on your own record. But any type of spouse where that person is actually still living, you have to file for benefits. So you have to file for benefits on your own record in order to get a spouse or a divorced spouse benefits. Jason, looking forward to the call with you today that I booked. Oh, yeah, that's right. Yep. So I do 90%, 99% of my help is free through live Q&As and all the videos I do. But to kind of pay the bills, I do personal consultations, private calls. So if you want to schedule one of those, just go to my website, just click on the description and you can schedule an appointment. And I'm about to call Jason here as soon as I'm finished, or a little bit after I'm finished, and see what kind of personal questions we can help them with. Should my monthly Social Security be calculated as more per month if I work 2 jobs most of my life? Yeah, it doesn't matter. You work, I work 2 jobs, 3 jobs most of my life. It depends how much you paid total and how much those jobs were. So, I know a lot of people that work 1 job and make 10 times more than I did. So it doesn't matter how many jobs. It matters how much you actually pay. Can I wait until I retire to file for Part A if my employer is paying my insurance now? Yep, absolutely. Yep. If you have health insurance from work and 20 or more employees, absolutely. Is there a limit I can earn and still draw my husband's survivor benefits? Yep. Up until your full retirement age, the limit this year is $22,320. How long does a reconsideration usually take? It really depends if it's a reconsider, because you can reconsider SSA 561. You can do a reconsideration on anything. So if your reconsideration is about a disability, then it's going to take about the same amount as your initial disability, 3 to 6 to 9 months. If it's, yeah, there's just a million different variables what the reconsideration is about. Can I suspend disability and when I reach FRA, will it be the same amount? Yeah, you can withdraw your disability application. Yeah, and yeah, once you if you wait until your full retirement age to start collecting benefits, yep, it'll be the same amount. Thank you for donating your time to this cause, doctor. You're welcome. Can you be on Obamacare until you're 65 if you're not working? Absolutely. Yeah. So that's what a lot of people do. Is they file, start their benefits at 60 or 62 or whatever the case may be, and because they just had enough of work, and they go ahead and get Obamacare, and then once they hit 65, then they pretty much have to switch to Medicare. Let's see, a little more clarity. My full Social Security was available 7/22. Will be starting August 24th. Spouses on SSDI. My payment will be a lot less. So was his used to figure mine? Yeah, I can't look at your record. I don't have access. So if his benefit amount is twice your amount, then I would definitely file for spouse claims. But yeah, I don't know whether you filed for a spouse claim at that time. If you filed and they took two claims at that time, then yes, they did. If they did not take two claims at that time, then you need to check to see if there's any spouse benefits there. Does Social Security average the three highest years of earnings to determine your benefits? No, it's the high 35 years, so 35 years of earnings. Can you explain protective filing, please? Well, considering I've only got 10 minutes, Social Security employees, yeah, it's so protective filing. I'll do an easy version. Um, if if you call Social Security today and want to file for retirement benefits, and they say, okay, yeah, we're booked up for 2 months. So you don't get your appointment for 2 months. And then that time something happens, you win the lottery. And so you go on a world vacation. And so you call them up and say, hey, I need to reschedule for 2 months later. So when you file 4 months in the future, you can actually start your benefits this month. Can you? Because you're protected for this month. So that's called a protective filing. So 4 months later, you can say, yeah, yeah, yeah. Remember when I called you 4 months ago and we just, we're never able to, yeah, I want my benefits to start there. So that's what a protective filing is. A lot of people, I found about $30,000 for this one lady. Actually, another $30,000 for another guy too. Yeah, a lot of people lose money because they don't know about protective filing. What documents are required when filing for Social Security for myself at 63? Yeah, they've expedited that. If you were born in the United States and your date of birth and everything is good on your Social Security card, internally there's the date of birth and your parents' names and your named or your name is spelled correctly and everything, then you don't even need a birth certificate anymore. They changed that policy a few years ago. So if you're U.S. citizen, then you don't need obviously a passport or anything. It's just your driver's license that shows your name, and that's pretty much it. Yeah, super super easy. Don't even need your birth certificate. If if you got married and you never changed your social security card and stuff like that, then you'll need the prove the new name, and if your date of birth is incorrect on the social security card, the internal thing, then you'll need your birth certificate and stuff like that. If you were born outside the United States, then you'll need the birth certificate or the family register or whatever it is. And don't translate it because Social Security doesn't accept translations. Social Security has to do the translating themselves. Hello, Dr. Ed. I appreciate what you're doing, helping and informing the people. Thank you. My question is, if you are a Social Security pensioner and SSI beneficiary, can you work part-time? Yeah, yeah. But in terms of SSI, because that's a welfare-based benefit, I just did a video a couple of days ago on SSI and working. So make sure you check out that for receiving any type of survivor benefits. I did a video on working while receiving Social Security, but SSI limitations are so much more because that's a welfare-based benefit. Was married 28 years, do not know where X is now, let alone if alive. How do I find out? Yep, easy, easy, easy. Call Social Security and say, hey, any more money on this particular person's record? Live, surviving, whatever the case, doesn't matter. If you don't know the Social Security number, no problem. Just call the 800 number and say, hey, here's the guy's name. Here's, I think his date of birth is about this time. I think he was born in this particular state and city. And they should be able to find the social security number. I've done that a million times, pretty easy. And then they'll look at that person's record and see if there's any more money on there. And if there's more money there, they will schedule you an appointment. They won't tell you how much, usually pretty cagey about that because it's personal information. But if they don't schedule you an appointment, that means there's no money. If they do, that means there's money. So if they say, okay, let's go ahead and schedule an appointment, that means, yep, yay, money. If I suspend disability, will I still receive Medicare and Medicaid? Yeah, if you suspend it, if you but well, yeah, well, if you're still disabled and yeah, it really depends how you if you're saying, hey, I'm no longer disabled, then yeah, Medicare, they might just stop it. Definitely Medicaid. But yeah, if you do it because you're going to go back to work, but you're still disabled, but you're working through your disability, then they do continue your Medicare. It's as long as your Medicare is the reason you're able to go back to work, because you are receiving, some type of health coverage that enables you to go back to work, then they will continue your Medicare. Divorced and want to start receiving benefits, divorce decree once it starts. Can I receive my Social Security benefit? Yeah, if that person is alive and kicking, then you have to file for benefits on your own record. All right, let's do one or two more questions. Let's see if there's anybody. I need to file for disability, but currently working, so you can't file for disability. If you're making over $1,550 a month, then Social Security says you're not disabled. So, yeah, once you stop working, you can go ahead and file. What's the website to know what your expected amount for Social Security would be? SSA.gov. If I had a bad back, do they require you to learn a new occupation sitting get a disability? No. My husband is 58, not in good health, keeps losing vision from diabetes. Can he file for disability? Absolutely. Tell him to file. Watch the 4 videos. I just did 4 videos on filing for disabilities, tips, tricks, and secrets on, helping you get your claim approved. So make sure you watch that. All right. That'll do it for today. Y'all have yourself an awesome night.